All right, this is picking up disorders from undifferentiated schizophrenia. And of course, this would be the catch-all category for a diagnosis that is schizophrenia, but nothing that's specific. This is somebody who has psychosis, of course, lack of touch with reality, and schizophrenic behavior that doesn't fit any of the previous categories. So overall, let's take a look at the causes of schizophrenia. The first is it can be a faulty regulation of dopamine by the central nervous system. Because of that, the treatment is to use medication to block the dopamine receptors. Most traditional antipsychotic drugs work this way. We'll study them when we look at therapies. Secondly, a biological predisposition to schizophrenia may be inherited. And an interesting note on this is deals with recreational drugs of the speed family, meaning drugs like amphetamines, etc. These actually increase dopamine in the brain, creating sort of an amphetamine-type schizophrenia. And the final indicator of schizophrenia, or perhaps cause, is that many who have schizophrenia have enlarged ventricle. This is that the chambers in the brain fill with cerebrospinal fluid, and instead of the tissue that should be there. Interestingly, there's a chicken and egg question about these swollen or larger ventricles, and that is it a cause or is it a consequence, which is kind of an interesting perspective. And a final note on this is that environment could actually be part of the cause, and this is where schizophrenia fits that category we talked about early on, about the connection between environment and the physical causes of mental illness. A good example is that a child born to two schizophrenic parents has a 48% chance of having the disorder, but overall it seems vulnerability to schizophrenia is inherited. Now, the other thing would be that there have been cases, specifically well-known cases, like the case of Sybil, which was a book that was turned into a movie about how children who suffer from repeated abuse will eventually sort of disappear into the world of schizophrenia in order to deal with the difficulties that they're facing. One other little note, ADHD, which we've talked about before, is treated with psychostimulant, and it actually helps the patient to focus. All right, now we move on to therapies. So we're going to take a look at what psychologists attempt to do in order to deal with these different mental illnesses that we've looked at. And the first type of therapy we'll talk about is insight or talk therapy. This is where the therapist obviously speaks with a patient. There's many types, but the common goal is to give the patient better understanding of themselves, as in many cases the patient is often the best therapist. So what the therapist attempts to do is to help to convince the patient that they actually control a lot of the things that they think they do not control. The first type of talk therapy would be psychoanalysis, and this of course comes from the Freudian tradition, and as we've talked about before, it starts with free association. At this point, the analyst is actually a blank screen for the patient. The patient's stream of consciousness will open and reveal their unconscious mind, according to Freud's view of psychoanalysis. The analyst starts slow and remains neutral to whatever it is that the patient has to say. Now, the fact that the analyst does not judge anything they say and remains neutral helps to create the beginnings of something called transference, according to Freud. And this is positive transference at first, and that's when the client feels good about the therapist and actually is happy that the therapist is not judging anything they're saying or making any kind of commentary about how what they're saying might be unusual. Now, what then occurs will be negative transference, which we'll see that occurs after the therapist has gained the trust of the patient. The analyst will become a sounding board for the patient's feelings about authority. So they'll tell the therapist what they feel or how they feel about authority figures in their life. Now, Freud has such a big focus on how children are raised and how they deal with their parents, especially their fathers, that he's looking for some sort of deep-seated issue that probably came up early on in the development of the personality of the client. And so the therapist is actually looking for how the client describes and discusses authority figures, which of course would be an indicator to what was going on unconsciously or subconsciously in the id-ego and superego battle that it makes up the patient's personality. But as the therapist will then continue to just be a sounding board and refuses to respond in any kind of real way to the client. So what I mean by this is the client will then begin to ask the therapist questions and say, what do you think, after they get much more comfortable after some number of sessions. And the therapist purposely does not answer them or give them any kind of indicator of how they feel about what the patient is saying. And so at this point, negative transference occurs as the client gets angry due to the lack of response. The sense that the client has is that, hey, I trusted you and now you don't support me, you won't tell me anything. And they're doing this on purpose to actually get the client angry. It's done specifically to view the patient's attitude towards authority, which of course would be their relationship with their superego. So what happens then is, as this continues, the therapist begins to be a bit more active and suggest alternative meanings for the client's comments, looking for connections to Freud's childhood stages of psychosexual development. So what happens at this point is that first the therapist gains the client's trust, and then he gets him angry, and he looks for connections to things that might take them back to those steps. And when the therapist finds one of those steps in Freud's personality theory that seem to have been somewhat difficult for the client, then the therapist will take the client back through, of course, discussion to their childhood, and eventually attempt to help them rework these conflicts. The patient then heals and builds from the old wounds and becomes stronger. So the premise is you've got to break them down and bring them back to that stage of development where it seems they had the difficulty, and then in a sense have them live through it again and find out that they are a much better person and more positive about themselves than they were before. Now, as you can see here on the notes, some easy criticisms are that because this will take 5 years or maybe more of weekly sessions, it takes way too long, and it tends to be very expensive. So let's turn now to a type of therapy that hopefully is not going to be quite as expensive, and this would be client-centered or person-centered therapy. And the man behind this, of course, is the humanist Carl Rogers. It's based on the humanist ideal. However, it is connected to the neo-Freudian view. In this particular type of therapy is even more solidly behind the idea that the client is the best therapist than Freud had been. Rogers felt that insight into current feelings was more important than how potty training affected you. He also felt that many problems relate to the conditional positive regard you've received from others. In other words, they haven't given you unconditional positive regard. By giving unconditional positive regard to the patient and by being a mirror to the patient, the therapist provide the client the opportunity to find themselves. So by unconditional positive regard, we mean true acceptance of the client no matter what they say or what they do in their therapy sessions. And acting as a mirror is the idea that instead of being judgmental, the therapist will actually use this phrase quite often: do I hear you saying whatever it is that the therapist believes the client might be saying? So do I hear you saying that you have difficulty with your parent or something along those lines? So it's very supportive, and by allowing the client to hear what they say themselves, then it helps them to get a better grasp of what it is that they're really dealing with. A lot of times when people say things, they don't really understand how they sound to others, and they don't understand that they may be telling other people things that they really don't realize they're saying by the way they say things. So the therapist provides the client the opportunity to become their own therapist and to, quote, find themselves. All right, let's move on to Gestalt theory. And of course, Gestaltists believe this idea that your personality, if there are problems, it has holes in it, and they must be filled to make you whole with a W. The Gestalt therapists believe that Freud invented the couch because he could not look people in the eye. Their belief, again, is that therapy should fill in the holes of personality. And Gestalt tries to make clients aware that they are the actor in their lives. Instead of, and this is the stuff we talked about in class the other day, instead of allowing the client to say, he makes me angry when he's around, they work with the client to change the way they view it to, I get angry when he's around. The client learns that they have control. So this is very much this part of the idea that you control your life, and the way you describe it can have an influence on it. Now, Gestalt therapy includes something called the empty chair technique, where the clients are asked to speak to a part of themselves. They're asked to sit next to themselves and ask questions. So literally, they'll put an empty chair next to the patient, and they'll have the patient ask themselves questions, so they become the therapist. Again, the patient is the best therapist, once again, in this talk therapy. This forces the patient to deal with their own feelings and thus better understand those feelings. Now, there are more recent therapies that have come around. Virtual therapy, meaning it's online, helps our fast-paced world, shortened versions of the old ones, but with similar goals and strategies. These methods save time and money. Another type of therapy, which is more direct and actually goes after the behaviors that occur rather than the underlying issues, would be behavior therapy. Behavior therapies are a type of therapy that concentrates on changing behavior rather than the thinking. It's based on behaviorist ideas and seeing normal and abnormal behavior as learned. So because they believe both normal and abnormal behavior is learned, they actually push the idea of conditioning to get people to change their behavior. So for instance, if there's something that's very much bothersome to you, they'll use a process of desensitization, which is to get you used to whatever it is being around, or the person, or whatever it might be, so that eventually you aren't as sensitive to them being around. So it's a step-by-step process, or shaping, as we've talked about in behaviorism before. They try to extinguish the behavior if at all possible. And one of the techniques they'll use if they think it's going to work is that they'll just throw you into the fire, or it's a method called flooding. And this is probably the best example of flooding, is the idea of teaching somebody to swim by just throwing them in the pool. So instead of some gradual step-by-step behavior that may be occurring, they'll just throw you directly into whatever it is that you need to deal with and force you to deal with it. So it's a bit drastic, but in some cases it's the best way to approach the issue. You'll also get aversive conditioning and behavior modification. Behavior modification can include a token economy. So you set up with the client the idea that if they behave the way that they should, they reward themselves, and if they behave a way they're not supposed to, they'll actually give themselves some sort of negative feedback in order to convince them through conditioning just to change the behavior. So if you had a habit you were trying to break, if you went ahead and did it, then the response would be, well, now you have to go clean the toilet or something like that. And the more times you end up having to clean the toilet, besides the fact that your toilet will be very clean, it also will condition you not to want to perform that behavior. That's behavior modification. And the token economy would be on the other side. If you do the right thing, then you give yourself some form of a reward. All right, we'll pick up with modeling and positive reinforcement on the next segment.